While working in the year 2000 as a clinical researcher in glaucoma in the office of a childhood ophthalmologist in New Haven, Connecticut, and a pre-medical student at Yale University, Jennifer Staple was shocked to see that so many cases of blindness were there, and they could have been prevented, and they were with people in low income and homeless patients. And so she formulated a plan that had two main objectives: educating people about eye disease and assisting the less fortunate in getting affordable or free medical eye care. So let's watch the monitors to see how Jennifer's efforts have touched the lives of so many.
This year, the Samuel S. Beard Award for Greatest Public Service by an individual 35 or under is given to Jennifer Staple. Several years ago, Jennifer was a pre-med student at Yale University, working as a clinical researcher of glaucoma. During her work with low-income and homeless patients, she was shocked to discover the large number of glaucoma cases that had progressed into blindness which could have been prevented. From that moment, she set two goals for herself: to educate people about eye disease and help the less fortunate obtain affordable or free medical eye care. She recruited a volunteer force of fellow Yale students and began collecting materials to help their cause. She called the effort Unite for Sight. Within a few years, other colleges across the U.S. began lending a hand, helping needy Americans improve their eye care. Today, Unite for Sight is an international movement in 25 countries with some 4,000 volunteers, providing free or affordable medical eye care services to nearly 500,000 patients in North America and in developing countries around the world. From a one-woman team to a worldwide initiative, the Jefferson Awards is pleased to honor a true philanthropist for public health for all, Jennifer Staple.
Thank you so much. It is an honor to be receiving this Jefferson Award and a privilege to speak before you this evening. For those of us involved in public service, people are at the heart of our movement. We are driven by a vision of innovation, of social entrepreneurship, and a passion to achieve global goals and create a world that is better and with less suffering than today's. I'm personally driven by a passion to eliminate preventable blindness and to develop effective healthcare delivery systems. Nearly a decade ago, I met patients in Connecticut who had become blind from glaucoma because, though they had health insurance, they were not aware of the importance of going to an eye doctor regularly to prevent blindness. It was these patient stories that motivated me to found Unite for Sight in my dorm room at Yale in 2000. The organization began in New Haven, Connecticut, but I realized after 3 years that I needed to eliminate patient barriers on a global scale. 80% of blindness is preventable, and 36 million people worldwide are needlessly blind. The life expectancy of a blind person in a developing country is 1/3 less than that of their sighted peers, and 90% of blind people in the developing world are not able to work. Meanwhile, sight-restoring surgery, cataract surgery, costs about $50 on average in the countries where Unite for Sight works, and receiving quality eye care services should be attainable for all. Unite for Sight has provided eye care to more than 800,000 people throughout the world, including more than 23,000 sight-restoring cataract surgeries. We have programs in North America, international programs in Ghana, Honduras, and India, and an annual Global Health and Innovation Summit that brings together 2,200 people from 50 states and from 55 countries. It is the impact that Unite for Sight is making in each community that inspires me most. Unite for Sight supports eye clinics worldwide by investing human and financial resources in their social ventures to eliminate preventable blindness and barriers to eye care. All of these eye care programs are locally led and managed by local ophthalmologists. One of those clinics is in Tamale, Ghana, which is in the northern region. Dr. Seth Wanye is the only ophthalmologist for 2 million people in this region. Before Unite for Sight started working with him, he was not able to provide a single cataract surgery because he didn't have the proper equipment, and the patients were not able to afford the $35 cataract surgery. We equipped Dr. Wanye with surgical equipment and provide grants to sponsor surgeries for patients living in extreme poverty. Today, Dr. Wanye provides more than 2,000 cataract surgeries each year. It is an honor to have an opportunity to support wonderful local physicians like Dr. Wanye to provide care to so many in their local community. Another ophthalmologist we work with in Ghana ran a small private eye clinic to provide surgery for 600 paying patients each year. Today, with Unite for Sight support, he provides more than 2,000 surgeries and 90% to patients who are living in extreme poverty. We're bringing outreach eye care services by local eye doctors into remote rural villages and locations that had never previously received eye care. I'm confident from my work with Unite for Sight that ideas, social entrepreneurship, and social investments can lead to systemic change. Andrew Carnegie created the public library system. He could have created a single library, but he envisioned something much larger and with a greater impact. A new system to provide universal access to information and knowledge and ideas now spread around the world in minutes. We as a global community can harness our collective talent and idealism in order to achieve our global goals. Thank you so much for this tremendous honor.